Brett Wallen, and this is going to be my head to toe video. I asked the recorder to take a look around the room, make sure there are no notes. First, I would check the patient's chart. Then I would provide the patient privacy, wash my hands, and then identify the patient. Can you confirm your name and your date of birth for me?
David Wallen, 21166.
Thank you very much. I've collected my stethoscope and my tools throughout the assessment. My name is Brett Wallen, and I'm going to be performing a full head-to-toe assessment on you today. What brings you in today?
Just general checkup.
Okay, and are you in any pain right now?
No.
Okay. So first I'm going to start off with your head, and let me know if you feel any tenderness or pain while I'm palpating, okay?
Mm-hmm.
Head is normal cephalic, round. There's no tenderness present. The hair is evenly distributed, soft to the touch, strong. Next is the temporomandibular joint. And can you move your jaw around for me? There's no crepitus present. And there's the pre-auricular lymph node, post-auricular lymph node, occipital lymph node, tonsillar, submandibular, submental, superficial cervical. And can you look to one side and bend your head? And pushing the muscle out of the way is the deep cervical on the other side. Okay. And then there's the posterior cervical. And can you hunch your shoulders up for me? And there's the supraclavicular. Tested the patient's skin turgor. There was no tenting. The skin replaced itself very quickly. The lymph nodes were non-palpable if they had been. As long as they were pea-sized or smaller and movable, they would be fine. I'm going to push on the tragus, pull on the pinna, and push on the mastoid process. Was there any tenderness in there? Okay. Next, I'm going to test your facial sensations. So I'm going to use these three tools, and I'm just going to touch you in different areas. I need you to tell me where you feel it and what it feels like, either sharp, soft, or dull, okay? Close your eyes.
Sharp, my chin, cheek. Just under my eyes, soft. Forehead kind of dull. Dull on my right chin. Soft on my right cheek. Sharp on my upper right forehead.
Okay, you can open your eyes. Cranial nerve 5 is intact. Can you raise your eyebrows? Lower them. Can you smile? Puff out your cheeks. Cranial nerve 7 is intact. Next thing, I'm going to check out your eyes. The outer facial structure. Eyes are symmetrical. Nose is symmetrical. The lips are symmetrical. Some facial hair on his upper lip, evenly distributed. The ears are symmetrical. And just stare straight ahead for me. Pupils are equal, round, and reactive to both consensual and direct light. And can you stare off into that corner real quick? And then I'm going to put my pen light right here. And when I say now, I need you to look at my pen light. Now. Pupils are also reactive to accommodation. The sclera is white. The iris is equal. Can you pull down on your eyelids for me? And then pull up on them. Conjunctiva is pink and moist. And now I need you to follow my pen light, and I'm going to move it in 6 different directions, okay?
Mm-hmm.
Thank you. Performing the 6 cardinal directions, I confirm that cranial nerves 3, 4, and 6 were all intact. Have you been to the eye doctor within the last year?
Yes.
Okay, and when you were there, did you use the chart with all the letters on it?
Yes.
Okay, and you did pretty well on there?
Yes.
Okay, cranial nerve 2 is intact. Have you had any other troubles with your eyes?
No.
Do you wear glasses?
For reading.
Okay. Have you had any eye surgeries done?
No.
Okay. Do you get headaches frequently?
No.
Okay. Have you had any other weird sensations with your head?
No.
Loss of balance, perhaps?
No.
Okay. Next, I'm going to check out your nose. The skin is clear of any lesions. Now I'm going to look up into your nose. Hair is evenly distributed. The structures are pink and moist. The turbinates are located. There don't appear to be any deviations. There's no perforations between the nose. Do you have any trouble smelling?
Mm-hmm.
Okay. And have you had excessive amount of broken noses?
Not excessive.
Not excessive? Okay. And do you get bloody noses very often?
In the wintertime sometimes.
In the wintertime? Okay. Cranial nerve 1 is intact. To further test it, I would have used a familiar scent and put it underneath and had him identify with his eyes closed to make sure that cranial nerve 1 was intact. Next, I'm going to check out your ears. There are no foreign objects. There's no excessive buildup of cerumen. There's no drainage coming from the ears. The top of the ear is in line with the outer canthus of the eye. Now I'm going to stand behind you and I'm going to rub my fingers together and tell me if you can hear it and which side you hear it on, okay?
Okay. Right side. Left side.
Cranial nerve 8 is intact. And now I'm going to check out your mouth, so if you could open up and stick your tongue out straight. And pull your tongue up. Teeth are intact. There's some dental work that's been done on the top right and bottom left. The buccal mucosa is pink and moist. The tonsils are +1 and they are also pink and moist. The pharyngeal wall is pink and moist. And could you open your mouth one more time and say ah? Thank you. The tongue was midline. The uvula raises with the patient saying ah, which shows that cranial nerve 10 is intact. I would normally perform a gag test, which would show that cranial nerve 9 is intact. And can you say the phrase back to me, light, tight, dynamite?
Light, tight, dynamite.
Cranial nerve 12 is intact. Next, I'm going to place my hands on your shoulders, and I want you to just raise up against resistance. Okay? And then push against my hand. On this side. Okay? Cranial nerve 11 is intact. There don't appear to be any abnormalities around the thyroid gland. If there had been, I would go behind the patient, push the trachea to one side, and feel the thyroid gland to make sure that it was not swollen or any other abnormalities with it. When the skin is warm and dry to the touch, the color is appropriate for ethnicity, both in the neck, the face, the ears, the nose, and around the mouth. Okay. And if I could just have you lay down for me. Having the patient lay down at completely flat, there's no jugular vein distension. If there had been, I would raise him up to 45 degrees to make sure that the distension dissipates. Now I'll move through his extremities and check his brachial pulse. And his radial pulse. Both the brachial and radial pulse are 2+ equal bilaterally. Now I'll check for capillary refill. Capillaries refill within less than 3 seconds. I'll next assess for any bruise within the carotid artery. So when I do this, I'm going to need you to take a breath in and then exhale and hold it on the exhale, and then I'll move it to 2 places, and once I've done that, then you'll take another deep breath in, out, and I'll move another 2, and we'll do that for a 3rd time as well, okay?
Okay.
And deep breath in and out. And breathe. And deep breath in and out. Okay. There were no bruits present. Next, I'll palpate the carotid artery. Carotid arteries are 2+ equal bilaterally. Before moving on, I'll palpate the temporal artery. Temporal artery is 2+ equal bilaterally. First, I'm going to map out my lung fields. The lung fields will start out here at the in the apices of the heart, and then they will go down here to the 5th intercostal space, forming a J and an L as I go through. There's no crepitus present. The color is appropriate for patient's ethnicity. Skin is appropriate. It also has pink undertones. It is warm and dry to the touch. So first we're going to start out with percussion. The sounds were resonant throughout. No signs of any dullness throughout the percussion. Next, I'm going to auscultate for breath sounds. So I need you to, as I move my stethoscope, each time you feel it go down, take a deep breath in and out, okay?
Mm-hmm.
If you feel dizzy at any time, just take a break and we'll go back to it once you feel better.
Okay.
Lung sounds are clear throughout. There's no signs of any crackles or wheezes throughout the entire lung field. Next, I'll be auscultating for heart sounds. First, I'll find the sternal notch and I'll move to his right side. And that'll be the aortic area on the right sternal border. Moving over to the left sternal border will be the pulmonic. Moving down to the third intercostal space is Erb's point. And then moving down to the fifth intercostal space at the left sternal border will be the tricuspid point. And then to mid-clavicular line, also still in the fifth intercostal space, will be the mitral point. S1 and S2 are apparent throughout each of the heart areas. It is a normal rate and rhythm. There don't appear to be any heaves or lifts at the point of maximal impulse. There's no edema present along bony prominences on the upper extremity. Can you grab my fingers and squeeze? Okay. And then put your hands like this and resist. And then keep them like that and resist. Okay. Strength is equal bilaterally between the two arms. Next, we'll move on to the abdomen. Have you had any troubles with bowel movements? Are you pretty regular?
Yep.
When was your last bowel movement?
Today.
Okay. And have you noticed any burning or stinging sensation when you go to urinate or have a bowel movement?
No.
Okay. Have you noticed any discharge coming from your penis or your rectum?
No.
Okay. Are you sexually active?
Yes.
Okay. Are you on any medications for bowel issues or urinary issues?
No.
Okay. On inspection, there's no apparent bulges or masses. The contour is flat. Your color is appropriate for ethnicity. Hair is evenly distributed. The umbilicus is midline. So I'll start out with auscultation. And I'll start in the right lower quadrant. Next, I'll auscultate for bruits within the renal arteries and the aortic artery, starting with the aortic in the middle, right above the umbilicus. And to the right, over my finger for the renal. And the other side. And then going below for the iliac. There are no bruits present. Next, I will percuss. The sound is tympanic throughout all four quadrants. Vowel noises were present through all four quadrants. Gurgling sound and is normal active. Skin is warm and dry to the touch. There are a few macules on his lower anterior chest and then a few throughout the abdomen. No abnormalities between the macules. I would also normally palpate the femoral artery, but for the purposes of this video, I will not. Moving down, I'll palpate the popliteal artery. And down to the dorsalis pedis. And the posterior tibial. All three locations have a pulse of 2+ equal bilaterally. There's no sign of edema throughout the bony prominences. Joints look normal. They are not swollen or aching. The hair is evenly distributed. It's appropriate for ethnicity. There's pink undertones to the skin. And then I'll do capillary refill. And this way. Okay. Capillaries refill within less than 3 seconds. Now I'm going to push on your feet and I need you to resist. And I'll pull them. Okay. And starting with this leg, try and lift it. Okay. And the other. All right. And you can go ahead and sit up again. And I need you to face this side. No, just stay seated. Oh, yep. And then face that side. First, I'm going to palpate the frontal sinuses and the maxillary. Those are located frontal and maxillary. Starting on the posterior chest, there are a few macules here and there, but none of them look abnormal. The skin is warm and dry to the touch. There's no sign of any crepitus. Hair is evenly distributed. There are pink undertones to the skin. So first, I will use tactile fremitus. Now I'm going to use the sides of my hand, and as I move down, each time you feel my hands touch, I need you to say 99, okay?
99, 99, 99, 99, 99, 99.
Okay. Sounds are felt throughout the entire lung field. The sounds diminish as I go lower. The lung field starts from the bony prominence at C7, and then using the bottom of the scapula, and I'll go down 3 more. That'll lead me to T10. And moving over to the side from T10 will give me T8, and I'll move up to T6. So first I will use percussion. Sounds are resonant throughout the entire lung field. There's no signs of any dullness throughout the percussion. Next, I'm going to use my stethoscope with the diaphragm to listen to the entire lung field. Each time you feel my stethoscope touch you, just take a deep breath in and deep breath out, okay? Lung sounds were clear throughout. There's no signs of any rhonchi or crackles or wheezes. And I need you to take a deep breath in and blow it all out. And deep breath in and out. Okay. The posterior chest expands symmetrically. And could you lift this arm up? And going from the side at the chest, moving to the back. The AP diameter is 1 to 2. Lower your arm. Have you had any troubles with any heart issues or breathing issues?
No.
How many pillows do you sleep with at night?
One.
One? Okay. Have you had any surgeries on your heart or your lungs?
No.
Okay. Next, I'm going to have you stand up and come over here. And if you could just walk to the end of the carpet and then back. Patient's gait is unlabored and deliberate. Can you take your right heel and run it down your left shin? And your left heel down your right shin. Okay. Patient maintains balance throughout test. No abnormalities. And can you stick your arms out for me? And close your eyes and touch your finger to your nose. And the other. Thank you. no abnormalities there. And next, if you could just stand feet shoulder width apart and your hands at your side, and then close your eyes. Thank you. There's no swaying or loss of balance throughout the Romberg test. Confirms that cranial nerve 8 is intact. And there were no signs of any loss of range of motion. Otherwise, I would have gone further and done range of motion testing throughout the assessment. And you can go ahead and have a seat. Have you noticed any kind of loss of weakness or a feeling of weakness when in your strength of your arms or your legs?
No.
Okay, any tingling sensations maybe in your feet or your fingers?
No.
Okay. And have you had any hearing loss?
No.
No? And have you ever had a history of skin cancer?
No.
Or abnormal moles?
No.
Okay. And the macules or the moles that I pointed out to you today, I just need you to keep an eye on them for any kind of asymmetry, like one side doesn't match another, they look weird. Check out the borders. If they have clear defined borders, then they're fine, but if they start to look a little wonky, then it's time to get them checked out.
Okay.
As well as the color, make sure it's a solid brown or tan color. If it starts to look mixed colors or anything like that, that may be an indicator. And then diameter, if it's larger than 6 millimeters, it should probably be checked out. And 6 millimeters is about the size of an eraser head,
Okay.
so you can use that to test it out. And also if they're elevated, if any of those things pop up, then it may be a good decision to get it checked out by a dermatologist.
Okay.
And can you tell me what season we're in right now?
Spring.
And where are we right now?
Wausau, Michigan.
Okay. Patient's appearance is erect, they're relaxed, their facial expression is relaxed, there's no signs of any respiratory distress or confusion. Their body movements were deliberate. Their behavior was consistent. They're dressed appropriately for this assessment. They are alert and oriented to person, place, and time. Their thought processes were clear and logical and understandable where they came from. They responded to verbal commands and other verbal cues. So they have a Glasgow Coma scale of 15. Throughout my entire assessment, the hair was evenly distributed, it was healthy, it was strong, it was soft to touch. The skin was all appropriate for ethnicity. It was all warm and dry to the touch. There was no apparent lesions except for those few macules that I pointed out. Thank you.